Thank you so much for joining us, everybody. We are super grateful to have you here. My name is Deborah Brown. I'm the Executive Director of Good Business Colorado. For those of you who don't know, Good Business Colorado is a grassroots organization of values-driven business owners working to build a more prosperous, equitable, and sustainable Colorado. And as the Executive Director, I have the privilege of working with incredible companies across the state, but no one's perfect, nor is any company. And so we put on educational programming aimed at helping good businesses be better. And we're so excited for today's workshop on healthcare for any budget. Before we get started, I'd like to thank our co-sponsors of this event. A huge shout out to the African Chamber of Commerce.
Thank you.
The Alliance Center, the Colorado Black Chamber of Commerce, Colorado Women's Chamber of Commerce, Downtown Colorado Inc., Entrepreneurship for All, the Latino Chamber of Commerce of Pueblo, the Longmont Sustainable Business Program, Pueblo West Chamber of Commerce, Rocky Mountain Microfinance Institute, Small Business Majority, Spur Leadership Coaching, that's today's workshop presenter, the Urban Leadership Foundation of Colorado, and Work-Life Partnership. I also want to flag that we have the third event in our three-part series coming up on November 4th. It's your employees' financial wellness, what you can do besides give a raise, and that'll be at noon on November 4th, Thursday, November 4th. And also to give you a heads up that as we conclude today's workshop, I'll put in the chat a link to a super quick evaluation form. If you could please take a couple minutes, not even a minute probably, to complete it. That really helps us determine what programming we should put forward next and make quality improvements. So thank you in advance for doing that. And now without further ado, I'd like to introduce you to the facilitator for today's workshop, Dan Cascabar. Dan's mission is to spur employees and employers to offer each other more good work. He founded Spur LLC to help organizations in Colorado build trusting teams, develop mid-level supervisors into leader coaches, and shape cultures that prioritize people. And especially delights in helping small businesses with frontline workers earning less than 30 an hour. He has developed people and people systems for 20 plus years, spanning talent acquisition, employee engagement, leadership development, program evaluation, process improvement, and pastoral care. He's a senior professional of human resources, serves on the Colorado Workforce Development Council Sector Steering Committee, and is a board member of Active Working. Dan lives in Denver and takes every opportunity to get in a good hike with his wife and 3 sons. So without further ado, I'll kick it over to you, Dan, and welcome everybody who has joined us.
Thank you very much, Deborah. I really appreciate it. I'm going to get right into the presentation today. We have a lot to cover, and this is one of my favorite topics because healthcare is so critical, and it's just becoming more and more so. And my real heart is to help I love what Deborah said, helping good businesses get better. I really want us as employers to figure out what options are most impactful and lead to the best outcomes for our employees. And more what we're learning in this healthcare space is that the cost of healthcare and employee value are actually becoming disconnected. And so it's really important to understand all of the nuance and the complexities so that you as employers can provide the right solutions for your employees. And so that's why I'm excited to bring some tools today. And I've got a special guest with me today, Jessica Smith from Connect for Health Colorado, who will be sharing more specifically on that resource, which is especially important during this time. I'm just going to start by talking a little bit about the series. The series is Improving Employee Retention and Well-Being. And as Deborah said, we had our first one last month on being an awesome boss. Today, we're talking about healthcare, and on November 4th, it's your employees' financial wellness. What can you do besides just give a raise or even maybe offer a retirement plan? There are many other options in between. So we'll be doing that on November 4th. But now to healthcare in the next hour. We're going to be defining the current healthcare challenge for employers and then providing resources and tools. It's really that simple. And so first, a few caveats. Healthcare is only a part of total compensation, right? But it's probably the most important part. Half of small business employees say medical benefits are a primary reason why they stay in their job. That's a really impressive statistic, and it's one that's been repeated by multiple studies over and over again. It's consistently and still the most important employee benefit. And medical bills are the top cause of personal bankruptcies in the United States. And we all either have ourselves or know someone probably who has set up a GoFundMe or other crowdfunding site for their own or for their friends or for their family members' medical bills. GoFundMe actually advertises this on their site now, that they're proud of the fact that they've put $650 million in crowdfunding money toward medical expenses. But that just shows how severe the need is in our communities and for our employees in terms of medical bills. The second thing is that healthcare is complicated, right? And you can't control the complexity as an employer, but the good news is advisors are your friends. There are many people here to help so that you don't have to understand all the complexities. But of course, employees are confused, right? They are anxious about their healthcare. They're confused about the alphabet soup of healthcare options. They're confused about the costs. They're confused about the value. And at the same time, in recent years, they're paying significantly more for less coverage. Employees coming off Medicaid are most vulnerable to shocks from medical costs, and employees with little margin often choose to opt out of healthcare coverage, right? Or skip preventive checkups or overuse emergency rooms and other high-cost care. There's lots of studies out there that show that. And of course, this results in poor health for the employee and their family, bad credit, potential bankruptcy, strained relationships, increased anxiety, low productivity, inability to work. This has tremendous consequences for employers. And often I see small business owners choosing expensive healthcare options because they either don't want to get bogged down in the weeds of healthcare, and it's anxiety inducing. A lot of times, we have a single broker pitching us a narrow set of options, and it's when we're already stressed out and we just want to find the simplest thing. I'm not a broker. I'm not earning any commissions on this. I am an HR specialist and a professional development guy. But I'm really, really passionate about this. I've had lots of conversations with brokers to understand many of the options that are out there. And at the end of the presentation, I'll share a few that I think are doing a really good job of customizing healthcare solutions that are saving employers money. That said, there's plenty in this space that I don't know. For example, I'm not a tax professional. Of course, with healthcare, there's many things that are tax related. You have to be very careful with how you go about things from the IRS perspective. And there are benefits advisors and brokers out there to help you with that. I just want to say your anxiety mirrors that of your employees, right? Your employees, again, don't understand how it works. Switching plans might mean switching doctors. It means also not knowing exactly how much you're going to pay with deductibles, co-insurance, co-pays. And for myself, a few years ago, I was introduced to a new kind of cost when one of my sons had to get x-rays. And turns out on the radiology on this plan, instead of having a copay or having it applied directly to a deductible, first it went to a per occurrence deductible. And wow. My broker had not told me anything about that. And so that year, my household ended up paying over 30% of our income on healthcare costs. It was literally insult to injury. And it was the motivation that I needed to get educated about this and to get educated on behalf of my employees to get this really figured out. So the last thing you need as an employer, right, is an employee who's frustrated, devastated, fed up with costs you didn't even know you were there when you were helping your select a policy with your broker and then not getting complete or accurate information. And so it does seem overwhelming to try to help educate or find the right person to do so. And the good news is that the people are out there, and that's part of the resource that I'm sharing today. We're all overwhelmed with the information. It's part of our total compensation strategy. It's easy to be biased toward the most simple thing as an employer, but that may bring significant pain for you. So it's prudent to get into the weeds a little bit. And so that's what we're going to do. Some say that healthcare is the second cost to employers in terms of total comp, only apart from salaries themselves. And so because, you know, there's a variety of systems and tax laws, there's a lot of freedom when you know what you're doing and when you have good advisors. And so the tools we'll be sharing today are most helpful for employers with less than 50 employees, but many of these principles apply to 50 plus, or what the Affordable Care Act would call applicable large employers. Moving on, I think it's really important to try to help simplify things by comparing healthcare to our vehicles. Think of wellness like we would our car. It's not only insurance, right? Insurance is protection for when things go really, really wrong. But preventive maintenance is the thing that keeps things in great shape. And we don't often take that approach to our bodies. We know that an ounce of prevention, right, is worth a pound of cure. But here in the United States, that's not how we use healthcare. It's not. We go to the doctor only when we're sick, and we think about our health often only when we're sick. That's starting to change, and I really hope it continues to change in that direction. The good news is the Colorado Health Exchange is one of the best run exchanges in the country. It provides high quality plans. In fact, right now I am on a plan that's on the Colorado Health Exchange in my family. And we're going to start here today by talking about the best options in the insurance space. And then we're going to get into this preventive maintenance, into other aspects of care, because insurance alone does not make anyone feel great. And this is nearly the cry of nearly all folks with lower incomes right now, many in middle incomes, and the majority of millennials and Gen Zers who are now entering and have been entering the workplace now for some time. One friend of mine summed it up nicely. If everyone was seeing a primary care physician and a therapist on a regular basis, from a preventive standpoint, it would be amazing, right? Employee retention has a lot to do with employee wellness, and employee wellness has a lot to do with not only insurance, but the feeling and the sense that employees have that the company really cares about their overall well-being, and that doesn't have to cost much. Supervisor support, for example, is directly linked to health outcomes of subordinates. That's why that was one of the primary topic last month. Of this 3-session series. It seems obvious, but we don't often talk about this link. But if you have a supervisor who's highly anxious, they are going to pass that anxiety right down the chain. And that anxiety leads to increases in healthcare utilization, increases in insurance claims. The data prove this. And so bad bosses increase that, and good bosses actually increase preventive healthcare utilization. Helping employees get healthier is good not only for employee retention, but it's good business, right? Healthcare costs go down 25%, and people are more satisfied with their care when they're empowered to take ownership, when they understand the complexity, or at least as much of the complexity as they need to for their situation, and feel empowered to make good decisions about their well-being. So the solutions, again, that we're providing today are within that lens, but they're by no means comprehensive. They're really just examples of what's out there to help you think more creatively about what you can do without breaking the bank. With that said, the link between employer cost and employee value is broken. Right. The bad news is providing a group health plan is extremely expensive. The Kaiser Family Foundation comes out with a study every year of what it costs for typical family coverage for a family of 4 through an employer-based group health plan. And their latest study said it was over $21,000. And the average employer cost of that $21,000 is $15,000, and the other $6,000 is paid for by the employee. That's just for the benefit of having health insurance. We're talking about premiums only. We're not even talking about use at that point. And the average deductible has gone up to above $3,000 for an individual, and it's rising fast. So it's depressing. That's why I'm labeling it bad news. And employers that offer group health insurance, right? The minimum contribution is 50% of an individual's premium. And if that plan is comparable, say, to a silver plan on the Colorado Health Exchange, that's going to cost the employer somewhere around $4,000 per employee. If they want to pay 100% of the cost, $2,000 per employee at that 50% rate. And if you're also providing, some portion of the family or household plan, it's going to get higher than that. That's kind of, it gets into really difficult territory for a lot of the small businesses that I know who are trying to reduce spend, especially right now in the face of COVID. But there is good news. And really what I want to stress here is the Colorado Health Exchange. Employers with less than 50 full-time employees do not need to offer a group health plan. And other options exist which simultaneously increase the value to the employee and reduce the cost to the employer. And the key here is helping employees access premium tax credits and cost sharing reductions. And that's why I'm happy to have Jessica Smith with us, because she's going to explain all of that. And really what I want to communicate is, as employers, if we have less than 50 FTEs and we're offering group health insurance, we are providing a subsidy that in many cases the government is already willing to provide to that same individual or household. And so we are literally replacing government dollars with our dollars, which doesn't make any sense. If the government is willing to provide that care and support for our employees, why would we not take advantage of that and then allow those costs to be put toward, or that savings rather, to be put toward other ways to improve our employee wellness. So that's really the focus here of what we're doing. Jessica is the Director of Outreach and Community Partnerships for the Colorado Health Exchange. And so, Jessica, I'm going to pass it off to you so you can share what this exchange is all about for the small employers in attendance.
Thank you, Dan. Hi, everyone. I am Jessica Smith with Connect for Health Colorado. I'm grateful to be here today. And, you know, Dan really hit the nail on the head, especially with the passing of the American Rescue Plan in March. There's a significantly more savings available to people right now from the government through the exchange. So like he said, you can be using those dollars to improve employee retention in other ways while letting the government handle those subsidies for you when you use the exchange. So I'm going to give you a basic overview of who we are and what we do and how that works. So if you want to go to the next slide, Connect for Health Colorado is the state's official health insurance marketplace. So when the Affordable Care Act passed, states had a choice to use the federal marketplace or create their own, and Colorado decided to create our own. And we are a nonprofit who runs the exchange in Colorado. We are the only place folks can apply for financial help to lower monthly insurance costs. We have free expert virtual and in-person help all over the state. And it's really great because you can compare different plans from different carriers all, you know, in one place. We really see these buckets of folks coming through our doors. You know, the Affordable Care Act was created to help folks who don't qualify for Medicaid and don't get health insurance from their employer and feel like there's no option for them. So that's who we were created to help. So we see a lot of self-employed people working for small businesses or small business owners, contractors, people who work for businesses that don't offer health insurance, and part-time workers. This is just a snapshot of all the different plans we offer across the state. So like I said, folks can compare plans from different carriers and see what works best for them. The way the financial help works through the exchange is we have what we call premium tax credits, which lower the monthly premium. So if someone qualifies for $200 a month in premium tax credits and they find a plan that's $300, the government will use these subsidies or premium tax credits to cover $200 a month, and the individual will be responsible for the extra $100 each month if in a $300 plan. Cost sharing reductions are also a way that we provide financial help, and that lowers out-of-pocket costs like co-payments and prescriptions. Some people qualify for both, and some people just qualify for premium tax credits, and that's all dependent on your income, your household size, and where you live. So this is an example. We put together some scenarios for you to give you kind of a picture of what people qualify for. So you can see here someone who is 40 with 3 people in their household making $70,000 a month would qualify for $509 in subsidies, so, or tax credits. So like Dan was saying, if you were thinking of doing something like an HRA, for example, or a group plan, if you weren't going to give them more than $500 a month, it would make, it would make sense for you to send them through the exchange. Or even if, you were, why not let the exchange pay the $500 instead of taking it out of your business's budget? So some other examples, we have a single person making $35,000 at age 35 would qualify for $174 in tax credits. $100,000, someone who's 50 with a household size of 4 qualifies for $711 in subsidies. And then we have a 25-year-old making $30,000 a year, living single in a single person household would qualify for $177. So really spans the income, age, and household sizes. People are all over those, are seeing savings through the exchange.
And Jessica, one thing I just want to point out about that is that you've got a scenario here with somebody with a 6-figure income who is eligible for a $700 monthly subsidy. And I think that's so important to highlight, because a lot of folks think, oh, these subsidies are only for people with extremely low incomes. And that's just simply not true, depending on your household type.
And you might have folks who came in previously and didn't qualify, but with the passing of the American Rescue Plan, as you can see here, people making people making up to, like you said, 6 figures are getting tax credits now because of the American Rescue Plan. And that is not on a timeline. It's a permanent change. So yes. So one thing we have, if you want to look for yourself, we have a tool on our website called the Plan Finder tool. This is anonymous and you can use it before you even go through the application. So you don't have to put all your information in, go through, a 20-page application to find out if you qualify or if your employee qualifies. They can use this tool anonymously. You just put in your first name, your income, your household size, and your zip code, and it'll tell you a very accurate estimate of how much you can save. And it will show you all the plans available to you in your area. And it also lets you put in your doctor and your prescription. So all before you go in to the actual application, you can look at all these things using this tool. This is what I really want to hammer home is that Connect for Health Colorado, as part of the Affordable Care Act, all of our brokers work free of charge. So, you guys have a lot on your plate. And like Dan was saying earlier, you just don't, it seems like a heavy load to dig into health insurance, the ins and outs of it. And what I'm here to tell you is that you don't have to, because our brokers are certified through us, experts. They can walk you through all your options. And they also can be a resource for your employees. So if you are just offering the subsidy, if you are just sending them to the exchange, you're not just leaving them to do it on their own. You can have a relationship with one of our brokers and say, this is our guy or this is our gal. They're going to walk you through the process, and they'll walk them through the enrollment process, help them pick the plan that's best for them, make sure they're getting the total amount of subsidies that they qualify for, all for no charge. So, you can still offer them a resource, even if you're sending them to the exchange. You can say, we have someone to walk you through the whole thing, because like Dan was saying earlier, it gives you anxiety. It gives me anxiety. When I work for the exchange, and still when I see my health insurance plan options, I call my dad. So this is a free resource to you. This page right here, this website, you can go on there. There's a map. You put in your, I think you put in your zip, it searches by zip code, and it will connect you to a local broker who can help you virtually, on the phone, or in person, and your employees. The next open enrollment period, so Connect for Health Colorado, as the exchange, we do have an enrollment period, and you can't enroll outside of the open enrollment period unless you experience a life-changing event. So the next open enrollment period is November 1st through January 15th. This is what I was just explaining. In certain scenarios, you can apply, you can sign up outside of the open enrollment period. So if you have somebody new coming on your team and they just lost their insurance from their other job, that counts as a life-changing event, loss of insurance. So they would qualify. And like I said, you know, if you had one of our brokers as your person, they come on the team and you can say, hey, here's our guy or gal. They'll walk you through the whole thing and they will be able to enroll outside of the open enrollment period. So this is kind of just what I was saying earlier. We know that you guys have a lot to manage right now, running a business. You don't need to understand everything about health insurance. We have someone to do that for you, free of charge. They can go over, you know, maybe you want to look into HRAs and they will walk you through, like I was just telling you, and tell you exactly, you know, you can tell them, here's like my employee's average salary. Here's, would they qualify for subsidies on the exchange, or should I be providing an HRA? You know, you can go through all these different scenarios with them at no cost. So this is our website here for small business owners and just small businesses and contractors and all that. That's where you can find yourself a broker to help out your employees and you. And that's our 800 number. But I don't know, Dan will probably be sending these slides out at the end. You can definitely include my email. I'm happy to be a resource for everyone on this call as well.
Thank you, Jessica. I really appreciate it. And we will be sending out the slides. Deborah will be doing that through Good Business Colorado. And next, I just want to highlight a few terms that we all talk about when we talk about health insurance. It's and healthcare in general, right? There's just so many, and this is such a small proportion. But you know, Jessica was talking about HRAs, health reimbursement arrangements. These are the kind of terms that, as Jessica pointed out, kind of make you want to call your dad and understand what is this alphabet soup. And so again, there's advisors to help. We're all here and ready for that. What I want to get to next, and many of you probably have questions for Jessica. I'm going to try to do this next part outside of insurance in 15 minutes, and that'll leave us some time for Q&A with myself and Jessica afterward. So there's so many different solutions out there. I just wanted to highlight a few here that I think are really valuable. Of course, we just talked about Connect for Health Colorado, which for employers, I've got the cost there on the left. The PPPM is per person per month. And so Connect for Health Colorado need not cost you anything. It's literally a referral from you to the exchange. Now, that isn't necessarily in and of itself lucrative for employees. If they say, well, do you offer health insurance? And you say, no, we just refer you to the exchange. That's not going to get them necessarily excited about working for you versus another company that is offering health insurance. This is the education piece that's necessary, because if you tell an employee, but the reason why we do it is so that we can change and shift that cost to other things that are really going to improve your health because we care, and you open up that conversation, then an employee will start to get excited. And so these options that I have here are the other things. HRAs are one of them that Jessica referred to, that we're going to talk about next to try to give you an idea of how to be creative with that cost savings that you could have from not offering a group health plan. So another zero benefit option, Benefits in Action. This is another nonprofit, and as the slide shows, it's a product of the Colorado Nonprofit Development Center. And what they do, they're located in Lakewood here in the Denver metro area, and they serve individuals throughout the state. But their goal is to increase understanding, access, and utilization of healthcare resources. Oops, sorry about that. And so what they're really trying to do is help people get to self-efficacy in navigating the healthcare system. And they have navigators to do that. And so they will walk with folks. And in fact, they'll even help them apply for any benefits that they might receive. They will walk people through applying on Connect for Health Colorado, for example, or through the PEAK website, Colorado PEAK. And this, they're very passionate about increasing healthcare benefit literacy among the public. And so you can literally make a referral of your employees to this organization, and they will help your employees discover what are their options. And so that's an additional resource above and beyond the brokers and advisors that Jessica referred to. The next thing that's another zero cost plan, of course, is Medicaid. And for those of you who were in last month's session, I shared this graph. And I think this graph is really important because what it shows is that different earnings levels along the x-axis here, you actually see the net resources of a household not necessarily making sense, right? And this is called the benefits cliff. And if you factor in public benefits, earned income tax credits, and every other resource that a household has access to through public assistance, as well as their earned income, for certain household types, as they make more income, they lose money. And what I mean by that is that their benefits are reduced by more than what is made up for by that income. Now, the Colorado Department of Health and Human Services is doing a really good job of fixing these things. And these are just a few example households of, for example, a single parent with 2 children and how this happens. And so I'm a huge fan of Medicaid because for households that need it, it is the best pound for pound insurance option that's out there. Now, if you were to, debate me on quality, we can have that debate, and I think it's a very real conversation to have. But the point here is that, again, employee value is disconnected from the cost that it would necessarily have to you as an employer for offering different insurance plans. So if you are an employer that offers, say, below $15 an hour jobs, you could very easily, which in Denver, that's right around minimum wage now in Denver, there are probably households that qualify for Medicaid. I want to go into this with a little more detail by providing some charts on the Medicaid limits. So if you look at that right column, the adult expansion of Medicaid in Colorado, it's expanded up to 133% of the federal poverty limit. That's what FPL stands for. And so for a household of 5, adults in that household, if you make $41,000, you're still eligible for Medicaid, which is a very lucrative option. And if you're an employer, you can't tell people to choose Medicaid versus going to the exchange or something else. But if they apply through the PEAK website or through Benefits in Action, they're going to find out that they're eligible for Medicaid. Now, not only is that important, but what's doubly important is if that household has children. Because if you see the limits for children are almost double what they are for an adult. And so they're 260% of federal poverty limit, which means that at $80,000, if you're a household of 5, your children are still eligible for CHIP or CHP plus, which is the Colorado Medicaid system. That means that if you're an employer and you're communicating with your employee and maybe you have a group plan right now and they're putting their whole household on their plan and they're a family of 5, but they're making less than $80,000, you're subsidizing something that the government would happily pay for, which is the healthcare of your children, right? And so it probably behooves you to let your employees know that if you're offering a group health plan or if they're going to the exchange, PEAK will figure that out for them. The benefits advisors that Jessica referred to will help your employees walk through this so that they know, look, you don't have to choose a whole family plan on the exchange. You could potentially offer or just pick a plan for yourself or for you and your spouse without having to do a whole family and save a lot of money. And that will be a significant financial lift for your employees. Now we'll go to the $9 option, $9 per person per month. And this is something you could fully subsidize as an employer. 9 Health, we all know them from the health fairs. of course, during COVID, had to cancel all their fares. And so they started working on a new solution and a new service. And the new service they came up with was Nine Health 365 Comprehensive. And what it is as you see there, it's a combination of 24/7 telehealth, health screenings, and educational resources on their website. So basically, instead of people coming to them for their fares, they're now going to the people, right? And so the 24/7 care is provided by this company, a local company here in Denver called Cirrus MD. And it's through text message, but it's through text message with a real doctor. And when it's necessary, they also include images, video, and voice. And it's guaranteed that your employees who subscribe to this service will have access to a doctor within a minute of asking the question. Now, that's pretty incredible service, and it's something that we've seen millennials and Gen Zers are all about. So the goal, right, is that you want a solution to help your employees know what to do when they're unsure what to do. And this is outside of insurance. It can be used with uninsured people. It can be used with underinsured, insured. It's insurance agnostic, right? The point is you pay $99 a year as an employer, and you give your employees access to 24/7 text-based telehealth, which for some employees is amazing. That's exactly what they want. And if you're a restaurant, the last thing you want, right, is an employee coming in coughing right now. And they're just going to come in if they don't have an easy resource. And so this is one of those easy resources. They also have partnered with Quest Diagnostics to do all these health screenings. And so they are lowering the cost of those screenings. And I think some of them are even providing for free as a benefit of being a part of this program. And they have a lot of educational resources, many of which are free on their website. So if you're looking for a low-cost solution that's not having to do with insurance, that creates employee value, this could be one. And there are many telehealth solutions out there. This is just one, but I really like their value prop over there at Nine Health. The next one I want to talk about is direct primary care. So direct primary care models are a model of a monthly membership fee. And for that membership fee, you have unlimited primary care office visits that can also handle a lot of urgent care. And this is, again, outside of insurance. It's insurance agnostic. So if you as an employer want to offer a unlimited primary care and urgent care office visit to your employees, you can do that for the cost of about $70 to $100 per employee per month. For example, this one that I have up here, NewMed, Adam is a wonderful guy. And I've seen this in action and how it really benefits employees. He allows for telemedicine, again, through phone, video, text, email. They also offer wholesale labs and medications, which often means it's 90% of the cost. So you're paying cash, you're avoiding having to deal with insurance, and you're just paying the person that's offering you these services, while avoiding those expensive insurance claims as an employee. And if you're offering group plans, potentially as an employer, that could affect your cost going forward. And so it offers employees peace of mind. And then it also can be a way to find early diagnosis and referral to treatment for commonly missed health problems and risk factors. This is about healthcare utilization of your employees in a preventive way. Most employees don't use healthcare because they don't know how much it's going to cost them. If they know it's free because it's supported by you, they will use the healthcare and they will become healthier people. This has been proven over and over again. I know insurance brokers who use DPC for their own employees, right? So it's not like this is against insurance. It's just supplemental to, or it could be instead of. If you feel like you can't offer an insurance product as an employer and you're above or below 50 employees, you can add this on. And it's important to talk to a benefits specialist about how to do that. I've even seen DPC on site at workplaces. There are workplaces that have converted small rooms into an exam room so that their workers can just come off the floor, be seen by a real doctor or physician assistant or nurse practitioner, get meds, have their labs taken care of, get seen, and then go right back to work instead of taking much of a day or maybe the whole day off if your employees are on public transportation. It's incredible in terms of a productivity win when you can do that with your employees. Next, I want to talk about HRAs. This is what Jessica mentioned, and they are health reimbursement arrangements. These were put into place just a few years ago by the government, because what happened was with the Affordable Care Act, there were all these employers who were saying, look, like we want to provide an opportunity for our employees to shop the exchange and have a lot more flexibility, variety, options in what they want to choose for their healthcare. But we have no way of subsidizing that. We have no way as an employer of reducing the pre-tax income for our employees when we send them to the exchange. And so what ends up happening is the only thing we can do is bump their salary. And when we do that, their income taxes go up. It's really inefficient, and they're unhappy and we're unhappy. So this is the solution that the government came up with, which is these are plans. The QSERA stands for a Qualified Small Employer Health Reimbursement Arrangement, and the ICHRA, ICHRA, is the Individual Contribution HRA. Some of the key differences I've put there in the table that you're seeing. And this is from PeopleKeep. PeopleKeep is an HRA administrator. So they are going to help you, if you call on them, administer and implement an HRA program. And what happens is these HRA investments that you make as an employer are all pre-tax. And so they show up for the employee in the same way like a medical plan would or anything else on their payroll, as long as that employee demonstrates that they're actually paying a premium cost. And everything that is eligible to pay for with a health savings account or an HSA, which includes things like dental and medical supplies, Band-Aids, even birth control, eye exams, all of that can be included in the amount that you as an employer contribute to your employees' HRA. And so it's beautiful because it carries over. You don't have to, if you don't use it all, that stays in an account for you as an employee. And there's in the ICHRA, for example, there's no cap on reimbursement. So you as an employer, if you have high value employees, you can separate your employees into different classes, and you could provide, I put 900 plus here because that's essentially the cap for a family plan on the QSERA. But with the ICHRA, you can move even higher than that if you want to as an employer. It's a tremendous tool to be able to offer value to your employees. Now, one key with the HRAs is that for the QSERA, it will reduce, and this is that second row here, in terms of the premium tax credit that Jessica was talking about, it will reduce your employees' tax credit amounts dollar for dollar for whatever you contribute. So in that sense, for your lower wage workers, or for, like we said, even six-figure employees that would be eligible for that, you're basically subsidizing something that the government would already subsidize. So that might not be a good option. But that's where benefit specialists can come in and help you determine, based on your employee census and your demographic information, which HRA is right for you. I have personally used PeopleKeep as our HRA administrator, and I'm very happy with them, which is why I'm putting them as a resource. The ICHRA, for employers with less than 50 employees, you can actually offer either a group plan, and actually this is true for employers with more than 50 employees too. You can offer a group plan to some employees and the ICHRA to other employees based on the classes that you create. So this is something that could be very, very flexible in the way that you offer it and who you offer it to, so every employee gets the benefit that's most valuable to them. I'm going to continue on here. We are almost done, and I just want to get into these custom solutions that I've talked about. So first of all, protections, and what I mean by that is really income protections for employee stability. Short-term and long-term disability policies are maybe more appropriate and important than ever. Most short-term and long-term policies, they'll do something like 60% of income reimbursement, right, for somebody who can't work for whatever reason. And those policies, you can find a lot of brokers, really any broker will offer this as part of what they offer. Life insurance policies are the same way. You can pay pennies a day for life insurance for your employees that will cover them in the event of their death. It will be a 1x or 2x or 3x annual earnings of your employees. This is stuff that makes people feel more stable and more comfortable, and knows that you really care about them and their household in the event that something goes wrong. Accidental death and dismemberment is probably the ugliest insurance title I've ever heard of any insurance before, but it really does make a difference if there's an accident. You know, if you end up losing a finger at work, for example, it will offer you and your family a payout. And then there's gap insurance. There's insurance to cover the gap in your insurance. And these are Affleck policies. There's where, you know, if your son gets a broken arm and that's the reason why you're using healthcare, they will reimburse you for that. If you have to stay in a hospital, of course, we all know that hospital stays are some of the most expensive things on our health insurance plans right now. There is an insurance policy that will insure the costs of you using a hospital stay. And the same thing for a critical illness. So there are lots of products out there. You can get really creative, and the more of these that you use, I think the more comfort and stability your employees will have, and the more of a sense of well-being they'll have about how you're handling them. And then we have mental wellness. Of course, this is a huge topic. I talked about this a lot last time. There are mindfulness apps out there that are blowing up right now, and they cost as little as $5 a month. You know, there's Headspace is a very popular one right now. Calm, Stop, Breathe, Think, Mood Kit. Google this and you'll find a tremendous number of these. And you as an employer can subsidize these by letting your employees expense them if you want to. You have to, you know, make sure you talk to a benefits specialist about how that works and what's defined as a, you know, health advice versus medical insurance, right, and things like that. But there's so many options available. One of them is BetterHelp Counseling, which is another telehealth tool specifically for mental health, where they offer counseling at $55 or more per session. So these things are out there to help you as employers really do the best you can at helping your employees with their well-being. And of course, there are wellness programs out there that package all of this, right? And they'll package health coaches alongside these things. They'll package gym memberships. They'll package, you know, discounts with trainers. And any benefits broker you will talk about is talking about wellness programs right now. There are some of these out there. If you are a little bit more open to high risk, there is a gray area right now with these wellness programs. There are wellness programs that are able to take the actuarial value of all of the benefits that are received within that wellness program and take that as a pre-tax deduction for employees, just like you would with a group health plan or with an HRA contribution, anything like that. And that will reduce their income tax and their FICA tax, and they will add that back in to their paycheck based on the fact that they're actually using that healthcare. And this is, again, I'm calling this a gray area because the IRS has not necessarily said this is a stamp of approval, but they also have not gone after any employer that's done this. And many employers and brokers have these solutions that can significantly save money for you and your employees. So if you are up for that more high risk thing, I would say talk to me because they take many forms and I want to make sure you're aware of all the risks of that. But like I said, there are many employers taking advantage of this as a huge opportunity and as a huge cost savings for them. So the key takeaways, number one, become educated. You know, what makes you feel good and secure and in control of your health and well-being? Chances are it's the same with your employees. So as a consumer, you know, how are things working for you? Number two, it makes sense when you feel a lack of control, when you're confronted with costs, but you do have lots of options Connect for Health Colorado is probably the best one for many people. Jessica and her team is awesome. So take advantage of the brokers that they work with, who are going to walk you through the process, so you can help educate your employees. You don't have to do it yourself. Healthcare is more than insurance, and there's a lot of innovation in this space, particularly around telehealth. Of course, we've all heard this. We're all often scrambling because we feel like we're behind the 8 ball, but I want you to feel empowered that you're able to make good decisions for your employees. And there are so many options out there for that. Don't just take the simplest solution because it's the narrow one that's been offered by, your broker that you've had for 10 years or whatever. And then finally, use your savings and insurance costs to add in those customized high value options for your employees. What do your employees value when it comes to their own wellness? Probably the most important first step is to ask them. And that's okay. A lot of times we get concerned about HIPAA and things like that. We're not asking employees for their health information. We're just giving them options and saying what would be most valuable to you, and making it an open conversation. And I think there are so many employees who want that conversation right now and who want to be presented with options and opportunities with their healthcare. A couple of innovative brokers here. I'm putting this up here just for a second. Mandy, Ronnie, and Todd are a few that I've spoken with who I think really understand all of the innovation going on in this space and the opportunities that exist for small employers, especially, to take advantage of the innovation. And then finally, the question is, how can I help you? I'm available for consultations to make your health, to help you make your health benefits work for your employees. My pricing is based on the number of employees, and it usually starts with helping you better understand your healthcare needs and the desires of your workforce. I provide consultations on total compensation, and especially appreciate the opportunity to work with businesses with essential workers and other frontline staff. My number one niche in the consulting side is to help you navigate solutions for employees making less than a living wage, which again, could be more than 6 figures in some cases, depending on the household makeup. And then my bread and butter is one-on-one coaching with key leaders and supervisors to help them become leaders and coaches so their teams get to top performance through trust and healthy relationships. That's really the goal. So with that, I will open it up to questions. We have about 7 minutes left. And I know, Deborah, you want to come back in too and be able to close us out. So I'll just open it up, and I know that was a ton of information, so I'll just pause there.
And in case anyone isn't able to stick around for questions, I'm going to post that evaluation now. So if, as we are closing or shortly thereafter, you could complete that, it'd be really appreciated. Well, watching as an employer, I was really inspired to think a little differently about our benefit packages. And definitely it seems like there's kind of a hybrid or like a compiling of different pieces to get a really full plan that might end up being significantly less than a traditional insurance plan. What would you say are the main components that every wellness plan should be looking at?
Yeah, that's a great question, Deborah. And I think really what we want to see are the ways to focus on prevention that make the most sense for your budget. And so what I alluded to with telehealth being a huge component of that, particularly if you have a younger workforce, that's what they want. They want telehealth. And then direct primary care is just such a beautiful, really, and simple strategy. So if you can layer those two on top of each other along with an insurance plan, I think that goes a long way. There's so many wellness plans that'll offer gym memberships and things like that, and I think those things are great. Like there's nothing wrong with a gym membership. The utilization on those tends to be a little lower, and it doesn't necessarily get to just as much utilization and the underlying anxiety of how much is this going to cost me to actually use health care. And that's where I think those preventive ones provide such enormous value for cost. we've got a shy constituency today.
Well, I'll just keep firing away then. I may have missed this, but I don't remember hearing about an option that's like catastrophe coverage just for medical, like emergencies, hospital stays. Is there a product like that out there, or did you cover that?
There is a product. Yeah, there are many products out there just for catastrophic coverage that may, remember the MEC is the minimum essential coverage, right? That was one of the terms. And the ACA plans will all meet that MEC requirement. There are also many other plans out there that are just retail plans that you can purchase that are catastrophic plans that don't meet the ACA requirements of a minimum essential coverage plan, but could be a good and cost-effective strategy if really your main concern is we want to make sure we protect our employees against a catastrophe. Yeah. In fact, one of these brokers that I mentioned, Mandy Kovalon from your healthinsuranceconsultant.net, she is really, really good at breaking healthcare plans down into their components, like catastrophic care versus preventive care versus, you know, direct primary care, all of those things. She's really good at doing that. And finding what solution is the right one if maybe the catastrophic piece is the one that you're most concerned about.
And I think, I hope I'm not wrong in this, but I think even within our own membership, we have a member who's on today who has an incredible amount of expertise in this area as well, Cindy, right?
Cindy, you're on mute, but I'd love to hear you tell me where I was wrong.
No, I'm actually really kind of fascinated by what I learned today, because some of this I actually didn't know. And I've managed employee benefits from the benefits side of things, not from like the health exchange. And even the information from Jessica that some of the rescue plan is going to stay through 2022, it gives me hope. So I found this very, very hopeful. So, and there's a lot of things in, you know, the gap insurance and stuff that you talked about can be very critical. I mean, you know, most employers offer those and they don't pay for them, but the broken arm situation can help people out because that can be $1,000 deductible. And those plans will help cover some of that. So you gave a lot of information and this has really been great.
I appreciate that, Cindy. And
I mean,
hats off
to
to
say
Jessica
hope
too.
about healthcare.
You don't hear that very often these days, do you?
No, and I don't know if other people feel that way too, but hope feels good.
Well, geez, I don't know if there's a better way to end than on that note.
I know, hope for healthcare.
Hope for healthcare. That is a thing now. Wow. Okay. Well, thank you so much, Dan, for that, and for Jessica for joining us. And thank you, Cindy, for chiming in with your expertise too at the end. And again, thank you so much to our sponsors, the African Chamber of Commerce, the Alliance Center, the Colorado Black Chamber of Commerce, the Colorado Women's Chamber of Commerce, Downtown Colorado, Inc., Entrepreneurship for All, the Latino Chamber of Commerce of Pueblo, Longmont Sustainable Business Program, the Pueblo West Chamber of Commerce, Rocky Mountain Microfinance Institute, Small Business Majority for Leadership Coaching, Urban Leadership Foundation of Colorado, and Work Life Partnership. We will be sending out the post-event email, as we mentioned, with the link to the recording, another link to the evaluation, as well as information on all of our event sponsors, so you can learn more about them as well. And again, we hope you will keep an eye out for and join us, register today for our final workshop series on November 4th at noon. And that's your employees' financial wellness, what you can do besides give a raise. And I think if you left here with some good ideas for healthcare, same type of thing, but in the vein of financial wellness. So we hope to see you on November 4th. And thank you again so much. I'm going to post that evaluation link again.
Thank you, Deborah.
Thank you.
Really appreciate
Thank you.
all
Thank
of
you.
Recording.